Hello, good afternoon, and welcome again to the HSE Weekly Press Briefing. Could I ask the speakers please to introduce themselves from the left?
And HSE lead for the vaccination programme.
Martin Cormigan, and the clinical lead for antimicrobial resistance and infection control.
Niamh O'Byrne, National Lead for Testing and Tracing.
Paul Reid, CEO.
And I'm Mark Brennock, National Director of Communications. This briefing is being broadcast live on the RT News channel and on the HSE Twitter feed. And could I ask Paul first to give his weekly update?
Thanks, Mark, and good afternoon, everybody. And just on our vaccination programme overall, a few brief comments. Nobody could have ever predicted the level of uptake that we would have seen in Ireland here from the vaccination programme. And if anybody had said to us, after 6-7 months of the programme, that you would be at 90% of the adult population partially vaccinated and practically 84% of the adult population fully vaccinated, and you're now in the 12 to 15-year-olds vaccination programme, we would have jumped at it at any stage. Our level of uptake and pace of rollout, particularly over the past few weeks and months, has been widely recognised and indeed lauded across many EU countries, indeed across the world by comparison with many others. So it's certainly been well above and beyond any of the expectations of uptake that we would have expected from the HSE's perspective. But in many ways, maybe we shouldn't be completely surprised by the uptake, because if you do look through the pandemic since March, February of last year, we've seen huge support from the public with a wide range of public health measures and indeed restrictions. And time after time, public, enterprise, business have made many sacrifices for the greater good. And we sincerely thank the Irish population and indeed enterprise and business for the support that they have provided to help us protect the health service in this period. The vaccination programme in reality does give us a new gateway back to a much better society, with now over 6.5 million vaccines administered here in Ireland, 2 million of those done by GPs. And some very recent survey research that we have back demonstrating that 97% of the people who experienced their vaccination in a vaccination centre were satisfied, very satisfied with the experience. So that's a really strong commendation for the people and everybody involved. But we're really anxious to finish the job off now in terms of this phase of the programme. Specifically on the 12 to 15-year-olds, our current focus remains on completing the dose 2s throughout the ages, and as we are now moving into 12 to 15-year-olds in particular. As of today, 124,000 of the 12 to 15-year-olds population have either registered online or attended through their GP pharmacy. And almost 72,000 in total have now been administered a vaccine in that 12 to 15-year age population. But today I would like to make a very specific and clear call to those who have not yet come forward for vaccination. First message is very clearly, be assured vaccinations are working. In fact, the evidence is extremely strong in terms of reduced illness, reduced hospitalizations coming through, reduced ICU admissions, and indeed reduced mortality. And we are seeing that by any comparisons with what we have seen earlier on this year with similar case levels. So if you are currently unvaccinated, you are at a significantly higher level of risk and may indeed put yourself or your family at a higher level of risk than they need to be. This is because we're continuing to see high daily case numbers of transmission levels in the community and steady rises in our hospitalizations and indeed in our ICUs. But it's never too late to register, and it's never too late to be vaccinated. And we in the HSE totally understand some people may still have a reluctance to come forward for vaccination. When we look at some of the unvaccinated in the population, some are people under the age of 18 whose parents and guardians are still weighing up and getting the information and the facts, and we totally understand that. And our view is that we encourage them to avail of all of the protection that the vaccination gives to their children. But we do understand that people want to inform themselves very fully of the facts. Others are in socially marginalised groups who may not be exposed to a regular flow of information that is available through media and our own sites and elsewhere. And we'll continuously work through vulnerable groups and their supportive and advocacy organisations to continue to reach many vulnerable groups across Ireland. Do encourage everybody to visit hse.ie or indeed engage with your GP or pharmacy for a discussion to get more information. But in the meantime, we'll continue the vaccination programme to work through the final phases of the programme that we're in. And indeed, I have relayed recently again why it's never too late of an experience I did have personally in the Sligo vaccination centre, where an 87-year-old woman drove up on one of our walk-in centre days and got administered with her first vaccine. Very clearly, she said she had thought about it for many months, had read the information, and had come to the view right now, after engagement with her family, it was right that she would protect herself. So I make that as an example to everybody that it's never too late, and we are fully supportive to support people to get the information. But again, I make a very clear call. You are putting yourself at a higher level of risk than you need to without being vaccinated. And particularly related to that is exactly where the virus levels are at overall in the community. The virus still poses a very real and live threat with extremely high and prevalent, still extremely high and prevalent in our communities. Age groups of 21 to 30 account for the highest proportion of referrals at 22% of positivity rate. And my colleague, Ms. Niamh O'Byrne, will give you some more details on what we're seeing coming through on the testing. But one thing in particular coming through to myself, 49% of new cases over the past 2 weeks were among people in the age of 19 to 44. But again, Niamh will give you some further information on all of that. So we do want to make this call that I have made before, as we are in the final phases of this vaccination programme, that we really need this time to continue to see it out, continue to give people their dose tools, continue to vaccinate the 12 to 15-year-olds. And in that period of time, people are not fully protected. We want to ensure over the next few weeks that people do still show huge caution, because we are dealing with high levels of transmission, high levels of positivity, and significant elements of the population still not fully protected. We are seeing that in terms of our trending rise and our hospitalizations. Hospital inpatients with COVID today are 244, which is up just about 20% on the same day last week. And ICU patients at 54, which is up from 36, so in essence a 50% increase from just last week. Last week I did give you some summary information of what we are capturing on a weekly basis, and no huge changes on it, but I will again relay the information that we've captured both in terms of hospitalizations in ICU, age profiles, vaccination status. So just give you a very quick summary. The vaccination status in ICU, 62% of ICU cases currently in hospital aren't vaccinated at all. So we haven't had any vaccination, which is very high proportion of the population who have not been vaccinated. 15% are partially vaccinated, remaining 23% fully vaccinated. The vaccination status in hospital, 52% of hospitalised cases aren't fully vaccinated. Again, high in proportion of 20% of the 10% of the population who haven't had a first vaccination, but 52% indeed is a high proportion. 45% are fully vaccinated, and this will obviously rise in proportion as we work through the whole population. 3% of the people in hospital, we just don't have the vaccination status. On hospitalisation cases and ages, a snapshot of this week of people in hospital, 63% of the hospitalised cases are over the age of 50. 31% of the hospitalised cases with COVID were between the ages of 19 to 49. And 6% of the hospitalised cases were in the ages of 0 to 18. In terms of ICU and ages, again, a snapshot, 58% of patients in ICU with COVID were over the age of 50, and 42% of ICU cases were between the ages of 19 to 49. So again, a very clear demonstration across all age groups in terms of ICU. Length of stay in hospital is averaging at 7 days, and the average age is 47. And length of stay in ICU, the average length of stay is 14 days. But within that, there's a huge range between 1 day and 97 days. Hospitalized cases with COVID, there's been much commentary, public questioning, understandably, of all the people in hospital in the count of that we count as COVID. What is their level of sickness with COVID? And just give you some status on that. 89% of the cases that have been admitted, of the cases have been either admitted with or now being treated for COVID in hospital. And 11% have been identified with COVID, but asymptomatic and not infectious. But again, still being monitored. And just to make the point, some of those can become infectious or symptomatic over time and will be continuously monitored. So the key message is just on overall and all of that between age and vaccination status. If you are vaccinated, you have significantly higher levels of protection from being hospitalized or entering ICU. The highest percentage of COVID patients in ICU are unvaccinated. And on the total COVID count of COVID patients in hospital, the vast majority are being treated for COVID, and in many cases are indeed quite sick. Just to give you a very quick summary of where we are in the vaccination program overall, we now have administered, as I mentioned earlier on, 6.5 million vaccines. 90% of the adult population received dose 1, and practically 84% of the adult population received their dose 2. On uptake, just to give you the very summary levels that we give you each week, again, 99% for those over the age of 80, 99% for those of 70 to 79, 97% for those 60 to 69, 99% for those 50 to 50, 95%, apologies, for those 50 to 59, 90% for those 40 to 49, 87% for those 30 to 39, and 79% for those in the ages 18 to 29. And just on overall total administrations, last week we administered just over 230,000 vaccines. Next week, as we expect, the week we're in right now, we expect to do 200,000. And then next week, our plan is just around 150,000. Happy to take questions later. I'll pass you to my colleague, Niamh O'Byrne.
Good afternoon, everybody. So just to take you through some of the key messages from test and tracing. So as Paul mentioned, we have 6.5 million vaccines delivered. We're just behind that in testing at 6.44 million tests at this point since the beginning of the pandemic. In testing, demand remains high, but it is steady. Most weekdays now we're covering around 15,000 tests in the community and 3,000-4,000 in the acute hospitals and private sector. We did in the community this week take 103,000 tests through our sites, and 92% of people can get a test within 24 hours. For testing positivity, this continues to rise. So in the community centres at the moment, this is 14% and does continue to grow. The positivity level in the 15 to 24-year-olds now stands at around 25%. Certain test sites are particularly busy. Those will be in Cavan, in Mayo, Galway and Tralee, and we are continuing to support those sites with additional capacity to make sure that everyone can get an online appointment within the same day. Pop-up sites do continue to operate. There are a number in Dublin, in Donegal and in Monaghan. And in some of those sites, we are looking to put a permanent static site as we find the right location. So for contact tracing, again, contact tracing continues to be a very busy place. We have over 996 staff now working in tracing. And this week we contacted 13,000 detected cases, which is up 16% from the prior week. And 31,000 close contacts were notified to us and contacted. And that's up 9% on the prior week. But the teams do continue to complete all tracing from 11 hours from the moment of the index case being notified as such. Within contact tracing, this week, the overall positivity rate for those who were identified as a close contact has risen this week to 18.9%. Household contacts do remain the highest form of close contact at 43% of all of our close contacts, and they also have the highest positivity level at 25%. 47% of close contacts now are fully vaccinated. So that continues to rise, although it's slowed down slightly since last week. We're opening an initiative within within contact tracing this week to continue to encourage people to give us all of their close contacts. We do note that the number of close contacts per person has dropped to 3.4. We do encourage people to give us both their vaccinated and their non-vaccinated close contacts, so that we are able to make the decision with them on the phone of who actually comes forward for testing. That's particularly important. We do expect at this point people to have 6 to 9 close contacts. And as I just said, it's kind of averaging out around 3.4. So we are going to continue to work with people to come forward to give us those details and allow us make contact with their close contacts. I just wanted to show you this particular graph on the community referrals. So I was mentioning there that we had 103,000. So you can see that this graph has moved over the last 6 weeks from anywhere between 93,000 tests to 109 over the course of the number of weeks. But it's the red line that's interesting, because if you look a number of weeks back, when we were doing 93,000 tests, we only had 5% community level positivity. And we now, on 102,000 tests, have a 14% positivity level. So that's what's driving up our case levels without driving up our testing volumes that significantly. It's the level of positivity that's coming through and the rise in the positivity between the 15 and 24-year-old group in particular. I've been mentioning over the last few weeks that we were doing a pilot, an antigen pilot. So I wanted to give you the first full results from the first report. We are a number of weeks into the study now, but this is the report from week 1. We are doing antigen testing. People are asked to do twice a week, 3 to 4 days apart, over a 4-week cycle. We began week 1 with 5 educational institutions and 8 creches. This has since grown, sorry, we seem to have moved forward there. The results of this so far is we've done 279 tests and we have 1 detected case in antigen, and that detected case was confirmed with PCR the following few days. So this will continue, and we'll see more results coming through. They come through at the end of every week, and we'll continue to show you what they look like. Generally speaking, people are finding the tests easy to use and there's no difficulty with them. The only thing that they've asked for is the development of the application that we are currently building that will help and support them to record the results. Finally, we do continue in our serial testing programs in the nursing homes and in the meat plants, where we are starting to see an uptick in some of the positivity levels and those who are coming forward for testing. So we're doing 11,000 tests per month in the meat plants with positivity of 1.27% and 9,875 in the nursing homes, where we have a positivity of 0.68%. Thank you. That's it for this week.
Thanks very much. So there's some repetition, so I'll go through fairly quickly the material that I have. So let me see. I hope I'm going forward. Okay, yeah, okay. So I'm going to start to talk a little bit about healthcare-associated infection, and some of these are graphs that you've seen before. And this illustrates the number of hospital-acquired cases of COVID-19 per week since we started collecting the data over a year ago. And you'll see on the right that the numbers have started to go up again in the last couple of weeks. We were at 42 for the week ending August the 8th, and that's up from the previous weeks were 16, 13, and 13. And that is a concern, obviously. The rate of increase is very different from what we saw in January, but it is a concern, and we're linking very closely with the hospitals and with the infection prevention and control teams to understand what's driving that and the options for additional interventions. The number of open outbreaks then is on the left of this slide, and that shows you again that that's increased. So we now have 13 open outbreaks in the acute hospital system, in the HSE hospitals, and we have also seen an increase in the number of cases that we see in hospital staff. Now, just to emphasize, for the acute hospital staff, what we capture is the number of hospital staff who've been detected as being a COVID case in that week. We don't know that it was acquired in the hospital. In many cases, obviously, it was acquired in the community, because you don't have there isn't a definition that we can apply in the way that we apply to patients. But again, we're seeing increase in numbers. And again, this is similar in terms of trend to the patterns we would have seen with previous big community waves, but attenuated. And we believe that attenuation is in a large measure related to the vaccination, as well as all the other measures that are in place in the acute hospital system, which are designed to pick up cases early and make sure that additional infection prevention and control measures are implemented very quickly. And the majority of the cases that we're seeing in the acute hospital now are picked up on testing before they become symptomatic. And as Paul referred to earlier, we watch that very closely because some people do become symptomatic later. So they're monitored very closely for their care and for the consequences, for the risks of spread. But the systems that are in place are picking up the vast majority of people who get hospital-acquired infection early enough to intervene to reduce the risk of spread as much as possible. The overview then is we have outbreaks in nursing homes again. Again, the impact of those is less than it was, but we have outbreaks in community hospital. The acute hospitals, we've talked about 5 new ones in the last week, and for a total of 13 open outbreaks. And again, just to explain, an outbreak remains open for an extended period because you leave the outbreak open until you're confident that there's no further transmission. You can see we've had some outbreaks in residential institutions, workplaces, and other settings as well. So the patterns of the outbreaks then, some of the cases do still involve relatively large numbers of patients. So we've had outbreaks involving up to 16 patients in some cases in the acute hospital sector, and we've seen large numbers of residents affected in some of the nursing home outbreaks. And we are seeing infections in people who are vaccinated as well as in unvaccinated. The difference is in the impact that we see on people who are vaccinated and unvaccinated. So there's a difference of degree in the sense that we see less infection in these people who are vaccinated, but also the people who are vaccinated are much less inclined to get ill. And quite a high number of the people who are vaccinated and who we identify as cases don't develop symptoms at all. So that has been a game changer in terms of the impact. Prevention, detection, and management remain an important focus for us. And as I say, we have regular engagements with colleagues in infection prevention and control teams in hospital and with public health teams to understand the severity of the illness, which is much reduced, but is still significant for some people. One of the things we try to do is understand what triggered an outbreak in a particular case, and then to see what the learning from that is, so that we feed that back into our guidance process and the education and training that we provide in terms of managing the risk. As with all infection prevention and control, as long as I've been doing it, before COVID and after, I expect, there is the challenge of preventing and controlling the spread of infection and also maintaining essential services. And that is the challenge that we manage. The easiest way in the world to prevent healthcare associated infection is not to deliver healthcare. That's clearly not an option. So what we have to do is manage the risk and keep it to the lowest level that's possible. Then some brief data that has been mentioned earlier, just the data on the 14-day incidence is, you can see here, is 498. As Paul reflected, the majority of cases are in younger people. The numbers of overall cases on the top there per day has increased, and we've seen the increase in hospitalization and ICU that Paul referred to. So I won't dwell on that. And again, this has been touched on in relation to very high registration rates, very high vaccine uptake rates, which is a tremendous success, as Paul has said, and I won't dwell on that. I just want to take a couple of minutes just to talk about what the vaccine does. And again, as I said, this has been touched on, but just to remind people that what the vaccine does is it gives your body a chance to make a little piece of the virus for the immune system to practice on. It takes a little time for the immune system to do its training on that piece of the virus. And that's why you don't get protected the day you get the first jab, because your immune system has to train up. If you are exposed to that little piece of the virus in advance, then what you've got is your immune system is prepped so that if you actually meet the live virus, your immune system is prepped and trained and ready to go. Much like the Mayo team, I might remark, being well trained and ready to go. The benefit depends then on how good your immune system can work with that vaccine. And that does vary because all of us are different on our immune system, and the benefit can decline over time. Others have also said this, it's a lot like a seatbelt. If you wear your seatbelt, it helps to keep you safe if there's an accident. If you wear your seatbelt, it helps to keep everybody else in the car safe as well. And if everyone wears a seatbelt, we have a lot less people in hospital and ICU after road traffic accidents. So it's a... And then, of course, seatbelts are great, but when you're wearing your seatbelt, you still have to be careful driving. You still need to obey the rules of the road, watch the speed limits, and remember that speed limits are limits, not targets. So on a given day, the limit might be 100, but it might be wise for you to drive at 80 or well below the limit. And even if everyone wears their seatbelt, of course, we will still see accidents, and we do still see, when we're doing the ICU ward round, we see people in ICU after road traffic accidents, more of them if they weren't wearing seatbelt, but you do still see people. And this is very like the vaccine. The vaccine helps to keep you safe. It keeps everyone around you safe. And if everyone wears their vaccine seatbelt, then we have a lot less people, as Paul has said, in ICU and in the hospital. Vaccines are great, but even if you have your vaccine seatbelt, it's still the public health advice is there. There are still speed limits that we're advising people to observe. The public health restrictions are like those speed limits. And it may be possible, or it may be within the rules to go to a meeting of 50 people. It doesn't mean that you should go to a meeting of 50 people, because it's important for people to consider their individual condition, their immune system, their health status. And some people will need to travel below the speed limit to keep themselves safe, particularly when we've got high community transmission at the moment. If you live with someone who's at very high risk, you need to take extra precautions as well. And of course, if everyone has their vaccine, it does not mean the virus will go away. It means the virus will do a lot less harm. And we can see that, and we've seen that already. So finally, fully vaccinated means you can do more of what's important to you with a lot less risk. But there is still a need to use judgment about what's the appropriate thing for you to do in your life in terms of what's important to you and the level of risk that's safe for you to take. And that's hard if you're one of the people who has to take extra precautions. But on the other hand, it's fantastic. I mean, it's absolutely fantastic to see people enjoying things in life again. The vaccine has made that possible. But as I say, some prudence is still required in terms of individual risk. Thank you very much.
Okay, and thank you very much, Martin. And now we take some questions. Yes, Paul.
Paul Quinn from Virgin Media News. Paul, can I ask you, and maybe Niamh, you can come in on this. I suppose people will be at home and you'd be saying, 84% of the population fully vaccinated, 91 dose, yet we're seeing high numbers of cases every evening. Why do you think that is? Is there a particular age group? I mean, you gave the figures there for people, like I think the 18 to 29-year-olds, 79% of that age group have been vaccinated. I know in Northern Ireland, that's an issue that they're having, that a lot of younger people aren't coming forward. What do you think the problem is down here? Why are we seeing such high cases?
Yeah, I think Niamh will give a good insight into what the cases are showing, from what gatherings they're showing from. But just at a general level, first of all, yes, we do have a very high uptake across all the ages we've moved through so far. But secondly, it's important to say not everybody has been vaccinated and not everybody is through their protection period. So you may have received your second vaccine. And this is a really important message to the public, because a lot of people are of the view they've got their second vaccine and protected fully and good to go. That's not the case, because there is a period for each of the vaccine types afterwards before you get the highest levels of protection, and you are never fully protected. So there's the highest levels of protection. And the second thing is, as it is at a higher level of transmission in the community, it does expose more people, which we've been talking about before, and Martin's been talking, and Colin been talking about, where you get more breakthrough cases into people who have been vaccinated. So higher prominence in the community, and more chance of risk of breakthrough cases. So those two are really important messages I'd like to give the public today, and even give you greater insight into the gatherings that we're seeing.
Yeah, so a couple of things I'd add to Paul is like 30% of our cases today are under the age of 18. So they wouldn't be vaccinated yet, certainly not fully vaccinated unless very vulnerable. 25 up to 25% of our cases can be in fully vaccinated people. It kind of ranges on the day, anywhere between 20 and 25%. And then also we have a very high positivity level in the 15 to 24 age group. So even with the great impact of the vaccination programme, there are still more people who do need to come into that vaccination programme to get that complete cover and allow the time to give them that cover so that they're not coming into the numbers.
Just on that, can I ask you, I know you mentioned that testing test centres was very busy. I think Cavan, Mayo, Galway, Tralee, places like that. Can you give us an insight into what exactly is going on here? Is this part of indoor hospitality, outdoor house parties, sporting events? Do you have any kind of information like that?
So still the largest is family outbreaks, and family get-togethers seems to be a large component. There is increasing numbers. Martin showed some of the outbreaks there. There are increasing numbers in hotels and restaurants. It's still not significant, but it is growing. And generally gatherings, barbecues, social events, it's the same criteria really as before, weddings, anything where there's large groups of people meeting indoors.
Finally, if I can just ask as well, Paul, you mentioned there are some figures around ICU hospitalizations. 45% of those in hospital are fully vaccinated, and nearly a quarter in ICU fully vaccinated. Do we know if those people all have underlying health conditions, or is that quite high? Then I know almost half of those in hospital have been fully vaccinated.
Yeah, if you take on the ICU, which I think is a good indication, and Dr. Catherine Mudaway from UHL was speaking during the week to media, and she kind of set it out fairly clear. They're seeing less people who are fully vaccinated. That stays the obvious in the figures. And of those who are vaccinated, primarily with some underlying conditions that they have, sometimes can be obesity, sometimes can be other conditions that they may have. So prominently other underlying conditions, what we're seeing. What she's certainly been saying, and as I'm talking to consultants, yes, they're seeing less very healthy, protected, fully vaccinated people coming through to hospitalizations and ICU, and certainly the levels of sickness that we are seeing, and it's reflecting the latest length of stay of people who are vaccinated, not the same high levels of sickness that we would have seen back in January. Martin, he's close to it.
Again, talking to my colleagues, that's very much the pattern that we're hearing is exactly as you said, and overwhelmingly the people who are in hospital fully vaccinated are people with underlying conditions. And I suppose that goes back to that point that we're making is even if you've got your seatbelt on, you need to drive at the speed that's right for you, because we're not all going to tolerate this virus equally well even after we're vaccinated. And so I think it's a really important message, is that it's great that people have some freedom in their lives again and they're able to do things, but the restrictions are speed limits, they're not targets. And I know lots of people, and I'm sure many of the people know lots of people who've made decisions that for them, you can go to a group of 50, but they're not going to 50 because they know what their condition is, they've discussed it with their doctor, and they're being that extra bit careful. So I suppose we would really encourage people to, drive at the speed that's appropriate for them, I suppose, is a key message.
Hi, Orla O'Donnell from RTE News. Just Paul, and anybody wants to add to it, is there concern about the reports about declining efficacy of the vaccines, and also the reduced efficacy in relation to the Delta variant? And what does that mean for our vaccine programme? Are we going to have a booster programme in the next few months, and is the HSE ready for it?
I'll take first, and maybe Martin might add something to it, Orla. We've always seen evidence emerge as we've progressed through this vaccination programme around efficacy levels of various vaccine types, etc. What has been very clear is the vaccines have worked for us, and they've worked to date. I made the point in the introduction around reduced hospitalizations, reduced ICU admissions, reduced mortality. And by any comparison with the case numbers that we're seeing now versus the case numbers that we're seeing in January, we're not seeing that level of hospitalisations. Still a concern and rising. There has been evidence emerge about potential reduced protections after time. The National Immunisation Advisory Committee are still assessing all of the evidence from a HSE perspective. We await guidance and direction around the booster campaign. At this point in time, we don't have a direction, and government policy is not being agreed to go to the booster campaign. And indeed, government are waiting further advice from NIAC on that. So we've gone through the scenarios. Damien and his team have led how we would plan for a booster campaign. But again, we don't have a direction on progressing a booster campaign at this stage. All the evidence would be indicating, particularly people with immunocompromised conditions, may need boosters. But again, we haven't got direction on that just yet.
When would you expect to get any direction, or when would you expect to hear from NIAC, or is there a timescale for that?
Yeah, I think the Minister had said just over the last few days that he expects to hear some further update from NIAC over the course of next week. But we don't envisage starting a booster campaign next week, etc. We envisage completing out the current vaccination programme into September.
And just finally, is there concern about, I suppose we've seen some evidence from the United States of what's happening to younger children. Obviously, it's going to be some time, if we don't know when, younger children younger than 12 will be vaccinated. Is there concern about the impact over the winter of the Delta variant on them? Are we ready for large numbers of younger children in hospital? Is that something that may happen?
Yeah, and I'm going to pass to Martin in a second, just maybe in both comments, but just on that, there's still not compelling, or there's emerging evidence in terms of younger children below the age of 12, what transmission levels they transmit at. So it's still early days, and certainly in terms of licensed products, it's still early days. There isn't a licensed product below the age of 12 at this stage, and the EMA are monitoring that, but there isn't a licensed product below the age of 12 right now. But Martin might be able to give further insight.
Just to say, all of these things, we are watching what the trends are in other countries and trying to get an early sense of what's likely to happen. I think it's not clear at this stage what the impact will be in children under 12, and it's not clear that vaccine has been, is required for that age. So there's so much to be concerned about, but there's a lot that you have to watch and wait and see. And the best guide to making the right decision at the time is to wait for the evidence. And as Paul says, we don't have the evidence there yet that we need to start vaccinating kids under 12, but everybody's watching it and learning as we go along.
Paul O'Donoghue from Newstalk. We were talking about breakthrough cases. Are we able to kind of put a percentage figure on how much likely you are to contract COVID if you're fully vaccinated, both showing symptoms and being asymptomatic?
I think Niamh can give you what we're seeing coming through on the testing numbers, which is the first gate measure we can look at. So positivity coming through on fully vaccinated people. And I think at the moment it's about 25%.
Yes, ranges on any given day between 20 and 25, but Martin might want to explain.
Well, it's an interesting and complicated question is the answer, because there's a lot of issues feed into it. I mean, what we have is very good information from the clinical trials about the efficacy of symptomatic infection. One of the challenges in answering the question that you posed is if asymptomatic infection in people who are fully vaccinated, we might not know about. And part of that question is how important is it to know about it in the day-to-day business? Because as the pandemic goes on, increasingly what we have to focus on is the harm that the virus does to people rather than the virus per se. So I think what you will see in most countries is that the focus is increasingly on monitoring the disease and the harm. There are lots of viruses that circulate and cause infection in the technical sense, but that we don't even know we have them. And so the focus will be on the disease. So I think what you're asking is a really good question. I think the best evidence we have for that is from the clinical trials. I think what we're seeing and what really matters from the clinical point of view is how many people get disease that impacts on them. And while we're seeing, when everybody is, if we got to the stage where everyone is vaccinated, I suppose if you look at it that way, then any cases we would see would be in the vaccinated people, but the proportion of cases we're seeing is so much lower. So I think, good question. I don't think there's a simple answer to it, but I think if we focus on the disease and the harm, that's where we can very clearly see the benefit.
Add to what both Niamh and myself said, like that figure of 20-25%, as Martin has just clarified, that will continue to grow as the population, or more and more of the population, are fully vaccinated. But the issue is how much harm, Martin's hit the nail on the head, does it do to a fully vaccinated person? And the obvious answer right now is, from what we're seeing on hospitalizations and ICU, it causes more harm for people who are not vaccinated.
I suppose the reason I ask that is because, like that, I suppose the concern from yourselves would be, if you're fully vaccinated and contract the virus asymptomatically, that you can still spread it. So is that still a concern for yourselves, if that makes sense, or something that you need to be cognizant of? Or like you're saying, is you can't really know it anyway, so there's no point even worrying about it?
Well, I wouldn't. I suppose I wouldn't say I don't worry about it. I think it's something we have to watch. I think we don't know what the end game of this pandemic is yet in terms of how it ends up. But one possible scenario that is being discussed a lot is that there are certain viruses that circulate and do relatively little harm. And one possibility, I saw an expression during the week in one of the discussions about this, is immunological détente. So one possibility is that you get to a stage where the virus continues to circulate it, but it does very little harm. The other possibility is that the virus goes away. As the pandemic has gone on, it's looked increasingly, I think, to people like the end game is probably going to be a circulating virus that's doing relatively little harm. But there's so much uncertainty. I think every one of us would say one of the things we've learned in the last year and a half is you think you've got it all figured out and it can change again. So the uncertainty is still there. But I think what we're looking at is a pattern where we're seeing the virus circulate but do a lot less harm.
That kind of end game that you're talking about there, is that when the adult population is as near to as fully vaccinated as possible? So I suppose that would include 12 up really now. So once 12 up is as basically as close to fully vaccinated as possible. Is that kind of end game that you're referring to?
I suppose the end game, I suppose, which we is that we get to the stage where people are not getting sick, or people are not getting very sick. I guess the focus, again, as Paul has said, the focus is on the harm. So it's people that matter to us all, in a sense, not the virus. So the end game is we get to a stage where we have a very low level of significant illness associated with the virus, either because the virus isn't circulating or because the virus is circulating, but we've reached that balance with it. I can't predict exactly which one of those scenarios we're going to reach, and I can't predict when we're going to get there. But it looks increasingly like that's probably going to be the scenario of circulating virus and getting to a stage where we have the lowest possible level of harm associated with the virus is, I think, likely to be where we're going to end up.
I'll just do the first part of the question because I think it came through strong in Martin's presentation. A key message from us today is, first of all, if you're not vaccinated, you are at higher risk. Secondly, if you are fully vaccinated and out of your protection period, you have a higher level of protection. And thirdly, when you do have a high level of protection, there's always risks, and there's still particularly higher risks with the highest level of transmission that we're seeing in the communities at the moment. So if you are fully vaccinated and out of your period and protected, still do take the cautions that Martin has spoke about. Still do take your own individual risk assessment about who you might meet, where you might gather, what function you might go to. I think they're really important messages we'd like to get through, and a personal risk assessment for everybody to continuously make.
I suppose just last thing then was there's kind of been talk in the last couple of days about no change really in restrictions until the end of September. I know obviously it's not something that you've a decision over, but the health service obviously is. So is the health service still really not at a point where we're able to kind of cope with this surge in infections? And if we're not at that point, when we've got almost 90% of the population fully vaccinated, will we ever be, and should we be worried about restrictions into winter?
Yeah, look, the first part of the question, I'll say the obvious. Any decisions on reduced restrictions, ultimately a policy decision for government. Certainly from a HSE perspective, we would always give our input to that decision. Where we're at right now in terms of hospital and healthcare is extremely busy, high levels of demand with the impacts from the previous 3 waves and also a cyber attack, seeing high levels of delayed care coming through. And as we head into winter, high levels of frailty coming through from older ages who have, not come through for care previously. So hospitals extremely busy. Secondly, COVID patients do have, not the patient's fault themselves, but numbers of COVID patients have a disproportionate impact on our hospital system, because even at a level we're at 240, 250, if that gets to 500 or 600, it's a very disproportionate impact, because you're not just talking about isolation rooms for some individuals in each hospital. You're talking about wards being taken over to cater for COVID patients. So there's a kind of an important point where you go beyond the numbers that we're at, or into 500 people in hospital, or more than 100 people in ICU are important risk factors in our health system. But ultimately, decisions for government, and we've always said from the health service perspective, we do know that longer term restrictions on society impact economy, certainly impact society, but also impact our health service. We're seeing significant delayed care coming through, and we're seeing significant issues in terms of both physical and mental health presenting itself. So it's a difficult call, but long-term restrictions hurt the health service too.
Hi, thanks. Niamh Griffin from the Irish Examiner. Professor Cormacan, can I ask you, with your background in infection control, what do you think about the demands from, demands from campaigners for easing visiting restrictions at the moment? How safe do you think that is for hospitals to consider?
It's something that we continue to work on, and to engage with people who have, we're engaging with people around discussions around that. It is, again, like so many things, about balance. We would very much like to see people be able to visit freely. The only reason that we ever consider restrictions is because we think that there's a need to do that to deliver care as safely as possible. And you would be aware that in some cases the infrastructure is not all that you would like it to be. You've got lots of people in a multi-bed room. So it's about trying to find that balance and that risk. And finding that balance means that we have to listen to people's concerns about access, for visitors, and also for nominated support partners. We have to look at that very carefully. We are reviewing it all the time, continue to work on it. We continue to try to find the balance, get that balance right. And the factors that come into that balance is the infrastructure, the amount of virus that's circulating in the community, and how confident that we are that the processes that we have in place allow access safely. So there's absolutely nobody that I know in the HSE who's interested in putting in the way of barriers to access. And the only barriers we put in are ones that we think are necessary to manage the risk. And we would try to reduce those as quickly as possible, and to engage with people to get a full understanding of how they're impacting them and what we can do to meet people's needs.
I think with the high, this is just part two, do you think with the high level of cases that we could be looking at a case where general wards and long stay wards will remain closed for the winter?
Well, I suppose one of the things I just say about closed is just to qualify that in terms of visiting guidance, one of the things that is really important to say, and it's been there from the very outset, and it's been there however bad things have been, is that you can never stop all access. There are people who need access, who desperately need access. And I don't just mean end of life. There are situations where people need to see people, and that almost must be accommodated. And we've been very clear that however difficult things get, there has to be compassion, and care for the person is the center of what we do. And infection prevention and control should never be a barrier to people having what they need. The whole purpose of infection prevention and control is to allow the safe delivery of care. It's never about denying people what they need.
And can I just ask, you were saying, Paul, maybe, or anyone who'd like to row in on it, telling people to risk assess and individually risk assess. What message would you have for teenagers and families who might be worried about going back to school in 2 weeks? And they're obviously very enthusiastic about vaccines, but they won't be fully protected.
Yeah, I'll just make a brief couple of comments, and Martin and Eve might want to comment. First of all, we are continuing to put a lot of work in our public health teams with the Department of Education to work through the issues in terms of return to school. What we have seen in previous school terms is really good supports from principals, teachers, schools overall around public health measures, and well supported by our NEVES teams on testing and tracing. And schools have progressed really well, even during a really bad wave the last time. And we'd expect the same again. So we are working at the levels of protection that need to be put in place. Schools are generally a well-controlled environment, and in many cases there are higher risks outside of the school environment, or maybe even travelling to the school environment, than there are actually in the school itself. So that's been the experience we've seen to date. And finally, the message from ourselves is obviously children not being at school, or the impacts that we saw from many research reports of children not being at school, the impacts on their own mental health as well can be significant. So, we're all anxious to keep schools functioning. But Niamh and Martin.
With testing and tracing and public health, we are currently preparing for the reopening of schools. We had a situation last September which we can monitor what happens this year. We expect additional viruses to run around at that time as well, which would increase testing. So usually around the second week of September, we do see increased volumes of testing coming forward. Hopefully it doesn't mean increased positivity levels, but we do expect to have high demand for testing for a mixture of general viruses that may be present in the school and in that age group, but also we expect there to be the level of cases that are in the country at the moment, for there to be cases in classrooms, and the same process that we followed last year in terms of the public health risk assessment and the mass testing of children. So over the first couple of weeks of September, we do expect to see that impact, and the teams are planning around that and planning how they respond between testing, tracing and public health.
Just one little piece I would add. Perspective of the importance of education. And to say, even
to recede, that there were some positive signs. How would you characterize the situation right now? It doesn't seem to have receded much in the last couple of weeks. Secondly, in terms of vaccination take-up in the 12 to 15 age cohort, where are we at right now? Are there signs that it is as high as in other groups? What are the indications at this point, roughly 8 or 9 days into that vaccination? And then thirdly, on restrictions, given the current pressures on the health service, would you anticipate that you would be comfortable with any further easing of restrictions in coming weeks? We're kind of almost into the final number of days in August. September will soon be upon us. Would you be comfortable if there was any move to further ease restrictions in the next couple of weeks? Thank you.
Thanks, Art. I'll share the questions to our colleagues. Just 3 responses. On the first one, I don't think we were of the belief that it was receding. We certainly felt it was beginning to hold at a case level and then rose very sharply within a week. And it's hard to predict what's happening this week, but it's maybe dropping slightly again from those 2,000 case levels, but not hugely. So we never really saw it receding, but we were kind of a hope it was beginning to hold. And we're still in that position right now. And the second one, just Damien can give you some of the figures on the vaccinations of 12 to 15-year-olds, but we're strongly encouraged in what we've seen with the uptake to date already. We're 1 week into it since people could register, and there's now probably over 125,000 people of the 269,000 in that population registered. And I gave the figures earlier on for those total, I think it's over 62,000 have been administered vaccines. So, and that's been a trend as we've gone through the younger age profiles, Arthur, where it's not a massive uptake on day one, but a continuous uptake. And that's what we're seeing through the ages. But Damien can give you further details on that. And finally, from my perspective, just on restrictions or further reduction of restrictions, again, just to make the point, ultimately policy decisions for government. We will give our input into it and our advice where we're at right now. Our hospitals are managing. Our issue right now at this point in time is non-COVID care. We want to get back to non-COVID care. We haven't given any direction out to the hospital system yet to stop elective care. Some individual sites will have done it for a period of days, but we're still aiming to address non-COVID care and elective care. We're obviously heading into a very difficult period in winter with other viruses we'll have to deal with, but ultimately decisions on restrictions will be for government. But we're managing, we're coping right now. We're nervous about trends we're seeing, and particularly the lag effect, Arthur, of those high cases and hospitalisations later.
15, Arthur, Paul's given the numbers, so I mean we'd be fairly comfortable where we're at relative to the other age groups. It is different because clearly, parental consent comes into play, and all of the other age groups, people are able to make their decisions independently, so it's a different process. There's other factors such as the summer season in terms of holidays. I suppose the two messages we've tried to get out to people is, in terms of who are interested or who have questions in relation to getting their children vaccinated. One is to use trusted sources, so hse.ie sets out both the benefits and risks. Secondly, if you're still concerned, you can talk to a healthcare professional. Thirdly, then we're trying to give access through a number of channels. So not only can you register, but we're also seeing interest through GPs and pharmacies. So some GPs are still participating, and there's a network of pharmacies still offering vaccine as well. And we're seeing reasonable numbers coming through those. So there's a range of areas where people can get information and a range of areas where people can get access. So, we continue to try and promote it, put the information out there. But so far, we'd be comfortable where we're at relative to the total population of that age group at the moment.
Niamh picked some of this up from some of the sites, but sorry, just clarify the figures. 72,000 have now been completed in that age group. But we are hearing some cases of people, families still on holidays and waiting to go back. They seem we're administering very quickly now if people register and wait until they come back from holidays to register and go online. So we hope to see that trend continue.
Lynch, Medical Independent. I was wondering, when are we going to be able to get some more data on the vaccination breakdown, say per county, per region? We get that data, say, on other vaccination programs, and also the uptake is obviously lower in certain, maybe more at-risk groups, such as the travelling community and the Roma population. Have we initiatives in there to deal with that, and do we have data on the uptake in those groups, please?
Maybe taking it just in terms of further breakdowns, Priscilla, the Health Protection Surveillance Centre are working through that at the moment, so we'll have that certainly fairly quickly now in terms of county level. Clearly, as the uptake's been so high across the board, the level of variation there is not enormous. What we're also tracking is the figures that Niamh gave earlier in relation to where there's high prevalence, is trying to promote uptake in some counties. So certain counties where there's high prevalence, we're now starting to try and promote, working with the pharmacy sector, again, about accessibility and about information to people, so that perhaps the numbers may not make huge difference in the percentages, but it could assist in those areas where there's high prevalence, just to push that vaccination and promote the vaccination, give the information to people and let them hopefully make decisions around it in terms of access as well. So we'll have the county level information available very soon through Health Protection Surveillance Centre. And as I say, they're using that, and we're using it to inform some of the operational decisions and communication campaigns that we're rolling out in conjunction with people like the pharmacy sector. Yeah, sorry. And then in terms of the vulnerable groups, I suppose we're continuing to work with, we've had a programme in place since we started with some of those communities, whether it's in terms of the traveller groups, and we've worked with advocacy groups around it, Roma, direct provision centres and so on, We're also conscious that for some communities there might be a natural resistance based on their own experiences with vaccines and so on. So we've worked with the advocacy groups who can then work with those communities. Equally, we're also looking, say, with groups like migrant workers who are working in certain industries and trying to work with those industries as well to try and, I suppose, provide information to people and give more access to people, maybe locally, into vaccine centres so that they could have the option to be vaccinated. Because again, we're aware of some of those countries perhaps where, you know, there may be a history there that isn't as strong as there is here in Ireland in relation to vaccine uptake. So I suppose that's another channel that we're trying to promote as well.
And will we get data on, say, healthcare worker vaccination uptake of the vaccine? Because we get that for the flu vaccine. And looking at those outbreaks in nursing homes, Professor Cormacan, were any of those unvaccinated, or what is the story there, I suppose, with unvaccinated staff and maybe new residents in nursing homes?
I'm going to be guarded on this because I think one of the things we don't want to get into is targeting anybody. But I think what we are seeing from the public health is there are instances certainly where we are concerned that unvaccinated healthcare workers may have contributed to the introduction of virus into certain settings. I'm sure that wasn't their intention, and we have to understand that there is some hesitancy around vaccination, and we try to work with colleagues on that. But there is clearly, we would be a lot more comfortable if all healthcare workers looking after vulnerable people were fully vaccinated. We do have a process in place to risk assess people who are not vaccinated, to look at the role that they're in, to look at the risk to them and the risk that they might pose to others. And in some cases, people may have to be redeployed, at least temporarily, if the risk to them or the risk to others is too high from being unvaccinated. So we're trying to manage this issue. I think it's fair to say our approach has been to try to manage this in as consensual a way as possible. We understand that people don't like being redeployed, but I think the commitment from the organisation has been to try to support people to get vaccinated, to try to support people who don't get vaccinated, but to try to support them in a way that protects everyone to the greatest extent possible.
There can be reasonable levels of churn. So new staff coming in who were not previously in some level sector nursing homes or indeed somewhere else. And the issue there is to make sure as people are coming forward that they are getting vaccinated as well. So there's a reasonable level of churn in the sector too.
There is a process in place in all of the CHOs for all the healthcare sector where if new employees come on that they can be referred in to be vaccinated. So there's a link there all the time to try and encourage that and increase the take-up.
Vaccinated, and they would like to get vaccinated, as David says, today is a good day. Yeah.
Paul O'Donoghue from Newstalk again. Sorry, I think it was yourself, Niamh, you were saying earlier that most outbreaks now are from family gatherings. Can you give any more detail on that? Like, is it, 50%, 80? Like, just a bit more detail on it?
I think I don't have a percentage because family outbreaks, there are so many that we don't count them in some of the outbreak numbers that Martin presented. They focus there on certain settings like nursing homes or workplaces. But family outbreaks do tend to be where we do see a large number of the cases coming from, as in you can see that in the household positivity levels for close contacts as well. So you have 45% of all of our close contacts are household members, and you see a 25% positivity level in household members. So it continues to be important for vaccinated and unvaccinated people if there are symptoms. And don't just think that because you have your vaccine, you're not going to contract the virus. If you have symptoms, you do need to come forward, and particularly if you're a household member living with somebody who is COVID positive, it's quite important to come forward for testing if you have symptoms.
I suppose just on that point as well, I guess given the relatively high number of breakthrough cases, or relatively high number of cases rather, just involving people who are fully vaccinated contracting the virus, has the HSE given any consideration to changing its policy of not testing close contacts who are fully vaccinated and asymptomatic?
Yes, it has been given consideration, but I might pass to you, Martin, to explain the decision.
I think all of these policy decisions are continuously reviewed in the light of emerging evidence and international experience. So I think throughout the pandemic, we haven't camped on positions. We've taken positions based on the best evidence available. Testing people who are fully vaccinated is a consideration, and it depends on how, and is done in certain settings, let me say, so that in certain very high risk settings where people are contacts, for example, in certain congregated healthcare settings where you might have a large number of people in a multi-bed area, we would still test people who are vaccinated or close contacts where there's a very high risk setting. But in general, we would expect that the yield from it would be low, and we would expect that the impact that it would have on reducing transmission in the community would be low. So it's a question of proportion. So with almost everything, you have a general approach, which is not to test people who are vaccinated and who are asymptomatic, but that is modified based on public health and infection prevention and control risk assessment in very specific environments where we know there's a very high risk.
I'm not sure what the full classification of a breakthrough case is, but I would distinguish between somebody fully vaccinated and protected and testing positive versus somebody being in a hospital or indeed ICU or mortality. Then that's a real breakthrough case.
On the 12 to 15-year-olds, how many are in that age group, and what percent of that age group is the HSE aiming to vaccinate, and when would you hope they're vaccinated?
75,000 ballpark in that age group. And we're not setting a target. I suppose we've learned that artificial targets around these things don't really serve a purpose. I suppose what we're trying to do is maximise it, as I said earlier, without sounding like a broken record, trying to get the information out to parents. We are conscious of the period that we're in. So, we were comfortable with the uptake we've had in the first week of this first 7 days. And clearly, as we come close to the end of the holiday season and the school season as well, we'll see whether people perhaps take that opportunity. And again, we've tried to make sure there's access through both the centres, the GPs and the pharmacies, so that people have a range of points of access, both from the perspective of getting the vaccine, but also if they need to talk to a healthcare professional, they have that opportunity to do so over and above the information that's available from trusted sources like hse.ie.
Thank you. Hi, Niamh Griffin from the Examiner again. Just some vaccine numbers, Damien, if you could please. Do we know how many pregnant women have been vaccinated? Are you getting any feedback yet on that?
I know one of the challenges in that, I'll just say, and we'll have to come back to you maybe separately, Niamh, on it, is that there are a number of people who have actually presented through the actual centres directly, if you know what I mean, rather than through the pregnancy pathway that's set up with all of the maternity units. But we do have numbers on those that have come through the maternity units. We can get those to you maybe afterwards.
And do you have numbers for how many vaccines the pharmacies have done altogether across the 3 age groups they're doing?
Yeah, so it's pharmacy at the moment in terms of their total split is over 200k, 215,000 in terms of across the vaccines, and they've been using both mRNA. As we know previously, they also use the Janssen vaccine as well.
And last one, the housebound vaccination programme, is that still going on?
Yeah, so there's 2 pieces to that. So the over 70s, we're closing out in terms of the dose 2s, and we're still getting some referrals. About 180 have been vaccinated under 70 as well, that over 16s pathway that we put in place for those that are housebound. So that's continuing in terms of dose 1 and dose 2. Small numbers of referrals, I would say, even in that category.
Just to say that next week we're going to take a very short August break from the weekly briefing and not have one on the 26th of August. We will return either the 2nd or 9th of September, and we'll let you know in plenty of time. Okay, thank you.